Hi, this is Dr. Tom Rogers at Performance Medicine, giving you the weekly podcast. Today we're going to talk about a special group of medicines that can be good and can be harmful. They're called PPIs, or Proton Pump Inhibitors. It's estimated that 70% of people that use these prescriptions, and you can even get them over the counter now, are really not needed, and they're used far too long. In fact, that's one of the main medicines I try to get people off of when I see their long list of medications. Now, proton pump inhibitors, which really do cut the acid out of your stomach. I mean, they cut almost all of it out of your stomach. So it creates a very alkaline environment for your stomach. And really, God gave you acid in your stomach for a reason, to digest your food, and thereby you will absorb your minerals like vitamin D. So, I mean, you need acid in your stomach to kill bugs for another reason, including bacteria and viruses. So what does a proton pump inhibitor do? Well, it inhibits those cells that pump out acid into the stomach. And no doubt they work really good for certain conditions. I mean, if you have heartburn, it really works really well. You know, it's more potent and works better than the first generation of what they called H2 blockers like Tagamet, then Zantac. So, you know, old-timey medicines that we used to use and still do use, as a matter of fact. And there are certain times when you may need a PPI. And PPIs are medicines like Prilosec, which is omeprazole, over the counter, Nexium, which is now over the counter, Protonix, and Dexilant. So, you know, there's quite a few of these things out there, and really I think they're overused. A lot of times a doctor even will put somebody on that, and the patient just stays on it without question, because it definitely does help GERD or heartburn. But there's some other things you can do to prevent this, because, you know, when you inhibit all the acid in your stomach, it can lead to a lot of problems. There's a lot of studies that have shown that it increases your risk of dementia, lupus. It definitely increases your chances of having gut infections. It increases your risk of osteoporosis because you can't absorb your vitamin D. B12 deficiencies, magnesium deficiencies, maybe even heart disease and kidney cancer, maybe even stomach cancer. You know, there's not a lot of double-blind placebo-controlled trials. These are all observational studies. And again, it may be because sicker people use this, that they get those diseases more often. But it definitely is something that really shouldn't be used over 2 weeks unless approved by a physician that knows what they're doing. It can increase your risk of pneumonia for sure. That's one reason why I get my COVID patients off a PPI onto an H2 blocker immediately if I'm treating for COVID. So that's the reason if I've treated you for COVID and I'm getting you off your Prilosec temporarily onto something a little lighter like an H2 blocker, Pepcid, which also works really well. So we know that things that can cause heartburn, like alcohol, and red wine, which is otherwise maybe good for you, seems to be worse at this than white wine or some other alcohols. But things like pepper, garlic, onions, chocolate. Dark chocolate does it to me for sure. And any adult out there has had heartburn, I'll guarantee you that. Citrus, coffee, tomatoes, sodas, all those things can do it. I find that greasy foods can give me heartburn a lot too. So what can you do to prevent GERD or acid reflux? Well, wear your clothes loose, stand up straight, A lot of older people get it because they slouch, and it puts a lot of pressure on that lower esophageal sphincter that keeps the acid from coming up into your esophagus. I mean, if you have a Barrett's esophagus, you probably do need to be on a PPI for a longer period of time. But again, we're all into prevention, so and more natural things if you can do it. Elevate the head of your bed for sure. Don't eat at night. Eat small meals. When you eat too much, your stomach's distended, and it puts pressure on that lower esophageal sphincter, and your food and acid can get back up into your esophagus. It's not good for it. Baking soda and water work really well for reflux. Ginger, even chewing some gum after a meal can help prevent heartburn. Apple cider vinegar. I'm really big on warm water. Warm water aids in digestion. It's really good for when you have a cold or a virus or a bacterial infection as well. I like warm water with a little bit of lemon drops in it and honey. Honey has so many healing effects. It's unbelievable. One of my favorite things, of course, that I talk about a lot to help you digest your food is Digestion. It's simply the best intestinal product I've ever run across. It has prebiotics, probiotics, digestive enzymes that help you break down mostly fats, but also proteins and carbohydrates. It has a gluten blocker. It has a lactose blocker. It blocks down lectins. So it really you can find yourself having a lot less GERD or heartburn by taking Digestion. I've certainly found that to be true. And you can tolerate more of the foods that you're going to eat occasionally when it's kind of off your list. But so these are some of the things that I've really focused on, because I do a lot of work with the gut. Gut health leads to your overall health. So, if somebody comes to me, they're tired, they have brain fog, they have autoimmune diseases, I always ask them about their gut. And about 99% of the time, their gut's off. Either they're constipated, they have gas, bloating, reflux, that kind of thing. And a lot of times, we just stick somebody on one of these PPIs, and they're on it for a long period of time, and it increases the risk of dying really from all those other things we just mentioned, including heart disease. So remember, you need some acid in your stomach. As a matter of fact, some people naturally don't have enough acid in their stomach, and they get a lot of stomach upset for that, and that's the cause. Not too much acid, too little acid. Probably over half the time. You can kind of test that by taking a little pill you can get over the counter called betaine, which is really hydrochloric acid. And if your stomach, if you take one and you don't have heartburn, take another one, you don't have heartburn, then you probably don't have enough acid in your stomach. So that's a simple little cheap test you can do to determine how much acid is in your stomach, because it's very hard to measure acid in your stomach. So, in these days when we're all probably over-medicated, when COVID's raging, if you have COVID, try to switch over to an H2 blocker like Pepcid is my favorite one, at least while you have COVID. Get off that PPI during that time. It's interesting, too, talking about COVID. You have a lot of COVID gets into your intestines. It gets into your stomach. And it's been shown that you can shed the virus from your stool for a long period of time, maybe months. It's usually gone from your respiratory tract in a matter of 2 to 3 weeks, when they measure it. So remember, COVID can really affect your intestines as well. A lot of the studies they're doing is testing wastewater to see if there's COVID in there, in college dorm rooms, etc. So remember, take care of your gut. Think about the food you eat, the timing of your eating. Certainly obesity, which is one of the main things I fight in my practice, leads to a lot more GERD and acid problems, or maybe not enough acid, a lot of intestinal problems. And certainly, it's just the most unhealthy thing you can do besides smoking is become obese. So think about taking care of your gut, the timing of the eating, what you eat, pay attention. Take Digestion to help you digest all those things that you need to do, and think about why you're taking that proton pump inhibitor. Ask your doctor about it. Why am I still on this? And try to get yourself off of that if possible. This is Dr. Tom Rogers talking about gut health again. I hope you have a very safe week, and we'll talk next week. Thank you.